Hi everyone, today I'm going to overview basic life support, otherwise known as BLS. And this is based on the American Heart Association guidelines as of July 2020. You can definitely watch this as a video. This is a little eyeball here, but you can also listen to it as a standalone audio file. Because when time came for me to recertify BLS and PALS, I thought, it's been a while. I see patients in clinic where, adenosine is rarely seen. So I prayed about how to study, and the Lord just gave me the idea to record the material. And that way I listened to it as I cooked and cleaned. So I hope this resource helps you pass the test with a more efficient study method and just also helps you do high quality CPR as well.
So I'm gonna just give a little quick disclaimer here, okay? I'm not earning money for this video, it's not monetized, I'm not an employee of the AHA, nor am I affiliated with them. I'm not liable for any harm or damage incurred related to this video. And this video does not constitute official AHA BLS certification. You are responsible for meeting the requirements of a licensed BLS teaching center to become officially certified.
I promise I won't talk that fast the rest of this video. Alrighty, onward to CPR. So BLS has two components, CPR and choking, and we're going to review both. What is CPR? CPR stands for cardiopulmonary resuscitation, and an easier way to say it is heart-lung help. I kind of like saying it that way because if you know what you're doing, you're more likely to do it correctly. CPR is basically the act of pumping somebody's heart when the heart is not working, and breathing for somebody's lungs when the lungs are not doing what they're supposed to do, okay? And there's three important age categories when it comes to CPR. An infant is under 1 year old. A kid or child is going to be infant up until before puberty starts. And once a person hits puberty onward, they're considered an adult. And puberty in boys is going to be known as chest or underarm hair. And in girls, any breast development signifies that puberty has started. All right, now we're going to talk about the steps leading up to CPR. So the first step is to assess the safety of the scene. Are there live wires? Is there a Tyrannosaurus Rex setting off a bomb? For the purposes of the class, it will be safe, but you need to verbalize that it's safe. And the second step is to assess responsiveness. In other words, can you wake up this person that looks like they're sleeping? You don't want to do CPR on somebody that's just taking a snooze on a bench. And how do you assess responsiveness? In infants, you're going to shout, "Baby, baby," tap the bottom of their foot vigorously or rub their back vigorously. You're never going to shake a baby, obviously. For kids and adults, do a sternal rub and shout their name. And then if the victim is unresponsive, at this point, you're going to move onward to getting help and assessing their heart and lungs. These steps are really happening simultaneously, and we're going to go through each of them in more detail. And then based on your assessment of their heart and lungs, you are going to act as needed. That's where CPR or giving just rescue breaths will come in. We'll talk about that. Okay, if you're alone with an unresponsive victim, you need help. And how you get help depends on whether or not it's an adult versus an infant or child, if you have a cell phone, and if you're alone. The BLS modules actually didn't cover all the possible scenarios based on these variables, but talking with the BLS instructor, using the info from the models, I hashed out, how you would respond in every potential scenario. So let's start with an adult victim. If you have help, you're not alone, that's ideal because one person can call 911, grab an AED, while the second person is assessing and assisting the victim. When we're talking about getting help, assessing is referring to checking the heart and lungs. We're going to talk more about that later. And assisting is talking about giving rescue breaths or doing CPR. We're also going to talk about that. Okay. What about if you're alone and you don't have a cell phone and you're with an unresponsive adult? You leave that unresponsive adult. You go call 911 on a payphone or flag somebody down who has a phone. You grab an AED if it's close, obviously you're going to use common sense. You're not going to spend 30 minutes looking for an AED, but you're going to come back after after that, and you're going to assess and assist the adult victim. What about if you were alone with an unresponsive adult and you have a cell phone? You're going to leave that victim and grab an AED if it's close by. You're going to come back, put 911 on speakerphone while assessing and assisting the victim, okay? And next we're going to talk about what to do for an unresponsive infant or child. If you have help, it's the same as how you respond to an adult. One person leaves, calls 911, gets an AED, while the second person assesses and assists, okay? The rest of the scenarios for an unresponsive infant or child are if you are alone. And the key difference is going to be whether or not you saw the child collapse or if you found them unresponsive, okay? So let's talk first about what to do if you witness the collapse. For example, a child is playing, a ball hits them in the chest, and then they collapse. If you witness the collapse, you're alone, and you don't have a cell phone, you leave, call 911, grab an AED, you come back and assess and assist the victim. If you witness the collapse and you have a cell phone, just like the adult scenario, you grab an AED if they're close, okay? If it's close, you come back to the unresponsive infant or child, you call 911 on speakerphone while assessing and assisting the victim. We're going to end here with the scenarios where you just happen upon an unresponsive infant or child. You did not see them go down. The key to keep in mind for an unwitnessed event with an infant or child victim is that CPR is a priority. You're going to assess and assist that unresponsive baby or child before leaving. Let's talk about if you come upon an unresponsive infant or child, you didn't see them go down, you're alone, and you don't have a phone. In that scenario, you're not going to leave to call 911, you're not going to leave to grab an AED, you are going to assess that child's heart and lungs, you're going to give them rescue breaths if needed. If they need CPR, you're going to do CPR for 2 minutes before leaving. This might be on your test. If you happen upon an unresponsive infant or child, you didn't see them go down, you don't have a cell phone, don't leave, assess and assist them. Give CPR for 2 minutes before you leave. And then finally, what about if you happen upon an unresponsive infant or child, you didn't see them go down, and you have a cell phone? You're not going to leave to get an AED. You're going to call 911 and put them on speakerphone, and you're going to assess and assist. If that child needs CPR, you give CPR for 2 minutes before leaving to grab an AED. All right, while calling for help for an unresponsive victim, you're basically assessing the heart and lungs at the same time. So you should do this by checking the victim's pulse and breathing. You can assess both at the same time, and it shouldn't take more than 10 seconds to do this, okay? And in an infant, you're gonna check the brachial pulse. I'll show you how to do that in just a second with this here baby doll, okay? So this is a baby doll, and an infant, you're gonna take 2 or 3 fingers. I'm gonna use 2. You're gonna go halfway between the shoulder and the elbow and put it on the medial surface of the baby's arm, the surface that would touch their torso, and you're gonna feel there for the brachial pulse, okay? For kids and adults, you're gonna feel for the carotid pulse, and pretend that this is an adult now. So you're gonna find the trachea right under the chin, on the neck, move laterally towards you, and in that groove, you should feel the carotid pulse. Alrighty, so you've checked the pulse, and then also you're gonna assess breathing. Is the victim breathing, and are they breathing normally? So gasping is not normal breathing. And then based on the above info, basically how's their pulse, how's their breathing, you're gonna respond. And there's 3 different scenarios. One scenario is the person's heart is fine, I drew a happy heart here, their pulse is good, and they're breathing fine, but they're unresponsive. In this case, you are going to monitor and you're going to wait for EMS, okay? The second scenario here is if the heart's doing okay, it's pumping fine, but the lungs are not doing what they should be doing. In this case, the person's not breathing or they're gasping, and what do you need to do? You need to give them breaths. This is what BLS calls rescue breaths. You need to breathe for them. For an adult victim, you're going to give them breaths. You're going to give a breath every 5 to 6 seconds, okay? For an infant or child, they need breaths more often. They need a breath every 3 to 5 seconds, okay? For an unresponsive infant or child whose pulse is okay, but they need breaths, they need a breath every 3 to 5 seconds. And clinically, this scenario might occur in an opioid overdose. So I put on this whiteboard, consider naloxone. You're not going to delay effective breaths, though, to give naloxone. And it's also important to continue checking the pulse every 2 minutes, because you don't want to be focused on breaths and find out 10 minutes into giving rescue breaths that this person's heart is stopped, okay? So check the pulse every 2 minutes. And then the last scenario here is if the heart is not pumping sufficiently, and basically that's going to be no pulse in an adult or under 60 beats per minute in an infant or child with port perfusion, okay? So this last scenario, the heart's not pumping enough, they're not breathing enough. In that case, that's where CPR comes in. And so next, we're actually going to cover how to do effective compressions, how to give effective breaths, and then we're going to put it all together in CPR. All right, so we're going to talk first about how to give effective breaths. The first step is to align the airway. I'm going to show you on this baby doll here, you're going to do something called the head tilt chin lift technique. You're going to put your palm on the victim's forehead and tilt back, and you're going to use the fingers of the other hand under the jaw to bring the chin forward. If you do this on yourself, it's actually quite refreshing. It's almost like you feel your airway become more aligned. And then at this point, you're going to give breaths. You're going to put air in this person's lungs, and you're either going to do that with your mouth, that's mouth to mouth, or with a mask, if you can blow into that, or if you have a bag and a mask, you would be pumping air into the person's lungs by pumping the bag. Let's talk about proper mask placement, okay? So this is a little mask. I know it's made out of foil, but basically it's shaped like an avocado, and you're going to place the more narrow part on the bridge of the victim's nose, and you're going to bring down the other part on the chin. And the way that you're going to keep it secure is the hand that is near the chin. You're going to form a C with your thumb and index finger, and then your other 3 fingers are going to form an E, okay? And you're going to place the C on the victim's jaw. That is going to secure the mask at that point, and then your other 3 fingers, the E, they're a little cramped around the baby doll, but they're going to go under the chin, and they're going to keep things in place. If you have help, if somebody else is there to, for example, operate the bag, you can use 2 hands on the mask. If it's just you, you can secure the mask with just the EC technique and use your other hand to operate the bag. And then a quick note on mouth to mouth. So when you are delivering breaths with your mouth, the nose needs to be covered or it needs to be sealed. So for an adult, you need to pinch the nose, and then your mouth will go on the victim's face and you'll give mouth to mouth. If it's a baby or a very small child and your mouth is able to cover both their nose and mouth, that's fine. It's just like your mouth is acting as a mask, covering both, and you can blow in that way. If you're uncomfortable with doing mouth to mouth, do high quality chest compressions and wait until EMS arrives. All right, that ends part 1. Click on part 2, linked below, to review high quality compressions, CPR, and choking.